The kidneys, those bean-shaped organs nestled in our lower back, are silent heroes in maintaining our overall health. These organs, frequently disregarded, exert a great deal of effort in filtering waste, maintaining electrolyte balance, and controlling blood pressure. However, our daily habits may significantly impact their health, leading to long-term damage. The choices we make in our lifestyle, including the foods we eat and the amount of water we drink, are extremely important to the health of our kidneys. Understanding and modifying these habits may be the key to preserving kidney health and preventing chronic kidney disease. So, let's dive in and uncover 12 everyday practices that are detrimental to your kidney health, unraveling how each one takes a toll on these vital organs. Always remember to check in with your doctor if you have any concerns about your kidney health. 1. Not drinking enough water. The kidneys play a crucial role in filtering and removing waste products from the blood. When you're dehydrated, the volume of blood decreases, and the concentration of waste increases. This higher concentration makes it harder for the kidneys to effectively filter these substances, leading to their accumulation in the body. It may increase the risk of kidney stones and other kidney-related issues. Dehydration may lead to muscle breakdown, releasing a protein called myoglobin into the bloodstream. The kidneys filter out myoglobin, but in large amounts it may form deposits in the kidney tissues, leading to inflammation and damage. In a study involving 12 healthy adults, the impact of hydration on renal function was examined. Participants followed both a low hydration regimen of 0.5 milliliter per kilogram of body weight and a high hydration dietary plan of 4 ml per kilogram of body weight for every alternate 30 minutes. The results showed that higher hydration levels decreased the glomerular filtration rate, a key indicator of kidney filtering efficiency, and increased sodium excretion. For instance, my patient Jane used to drink very little water throughout the day, often feeling sluggish and experiencing frequent headaches. After being diagnosed with early-stage kidney disease, she started tracking her water intake and aimed for at least 1.5 to 2 liters per day. Over time, she noticed a significant improvement in her energy levels and overall kidney function. 2. Overuse of painkillers. Painkillers act as saviors in difficult times but also harm the kidneys, especially when taken in large doses or over a prolonged period. They may reduce blood flow to the kidneys, affecting their ability to function properly. A study including over 11,000 initially healthy men, ranging in age from 40 to 84, examined this issue for more than 14 years. The investigators found that men who reported taking 2,500 or more analgesic pills, equivalent to 3 or 4 pills a week, were no more likely to show signs of renal damage than men who rarely or never use such painkillers. However, taking more than that without precautions may damage the kidneys. For example, my patient Tom used to take ibuprofen almost daily for chronic back pain. After learning about the risks to his kidneys, he consulted his doctor and switched to alternative pain management methods, including physical therapy and mindfulness techniques. This change helped reduce his dependence on painkillers and protect his kidney health. 3. High salt intake. Consuming too much salt makes it difficult for the kidneys to remove fluid, leading to fluid buildup in the body and elevated blood pressure, which stiffens and narrows blood vessels, reducing blood and oxygen flow to vital organs. Over time, it may damage the kidney's filtering units and lead to scarring, impairing their ability to regulate fluid. High salt intake significantly impacts kidney function by altering glomerular hemodynamics, the process by which the kidneys filter blood. Such effects are especially concerning in groups with high salt sensitivity, including the elderly, obese, and diabetics, where the risk of kidney damage and disease progression is notably higher. To mitigate these risks, experts recommend a low-sodium diet, ideally not exceeding 1,500 mg per day for most adults. This diet helps manage blood pressure and reduces the burden on the kidneys. My patient Laura loved salty snacks and frequently added extra salt to her meals. After being diagnosed with high blood pressure and early kidney disease, she gradually reduced her salt intake, using herbs and spices to flavor her food instead. This change helped lower her blood pressure and improve her kidney health. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. 4. Too much alcohol consumption. Next time you order another drink at the party, remember that alcohol may alter kidney function, making them less able to filter blood effectively. Chronic drinking may also cause liver disease, which adds strain to the kidney. Liver disease impairs the balance of blood flow to the kidneys, which is crucial for proper filtration. This dual organ dysfunction is particularly evident in patients with alcohol dependence. According to several studies, alcohol may elevate oxidative stress, resulting in the increased production of an excessive amount of free radicals, which in turn trigger tissue injury and increase inflammation, promoting kidney dysfunction. For example, my patient John was a regular drinker and experienced frequent hangovers and fatigue. After developing early signs of liver and kidney issues, he decided to cut back on alcohol, limiting his intake to special occasions. This decision significantly improved his liver and kidney function. 5. Smoking. Smoking may interfere with medications used to treat high blood pressure, a leading cause of kidney disease. It also slows down blood flow to essential organs, impairing the kidney's ability to perform their critical functions effectively, such as filtering waste from the blood and regulating fluid balance in the body. A study involving around 200 patients conducted for 4 years analyzed the impact of smoking on chronic kidney disease. It found that smoking significantly raises the risk of chronic kidney disease. Current smokers had a higher risk compared to non-smokers, especially those with a high cumulative smoking history. The risk was most pronounced in cases of hypertensive nephropathy and diabetic nephropathy. For example, my patient Emma was a long-term smoker and struggled with high blood pressure. After being diagnosed with chronic kidney disease, she joined a smoking cessation program. Quitting smoking helped improve her blood pressure and reduce the progression of her kidney disease. 6. Excessive caffeine consumption. We all love our morning coffees, but did you know that excess coffee might be damaging your kidneys? When consumed in large quantities, more than 3 cups per day, it may increase potassium levels. An 8-ounce cup of black coffee contains 116 milligrams of potassium, and adding creamers or milk further increases this content. This mineral is vital for the proper functioning of the kidneys and muscles as an electrolyte, but these mechanisms may be impaired and our bodies put at risk when blood potassium levels are high. A study involving over 5,800 overweight or obese elderly individuals with metabolic syndrome examined the impact of caffeine on kidney health. It found that consuming more than 2 cups of caffeinated coffee, or at least 1 cup of tea daily, led to a greater decrease in kidney function over a year, compared to those who drank less. For instance, my patient Nancy used to drink several cups of coffee throughout the day. After experiencing kidney-related symptoms, she reduced her caffeine intake to 1 cup in the morning and switched to herbal teas for the rest of the day. This change helped stabilize her potassium levels and support her kidney health. 7. High sugar diet. Dietary choices may have a negative impact on our health, particularly on vital organs like the kidneys, if we do not exercise caution. Sugar, particularly fructose, is hypothesized to cause kidney disease. High sugar consumption has been linked to several risk factors, including increased serum uric acid levels, diabetes, and obesity, all of which may collectively contribute to damaged kidneys, especially in diabetic individuals. Too much sugar may lead to kidney damage. In fact, after 15 years of having the disease, approximately 1/3 of diabetic patients showed signs of microalbuminuria, a condition of elevated albumin presence in the urine. Moreover, less than half of them developed true nephropathy, a disease affecting kidney functions. However, by monitoring your sugar intake, you may protect your health. According to the American Heart Association, men may consume no more than 9 teaspoons, around 36 grams or 150 calories, of added sugar per day, and for women, the limit is 6 teaspoons, equivalent to 25 grams or 100 calories, per day. For example, my patient David had a sweet tooth and often indulged in sugary snacks and drinks. After being diagnosed with prediabetes and early kidney disease, he cut back on added sugars and started eating more whole foods like fruits and vegetables. This change helped him manage his blood sugar levels and protect his kidney function. 8. Ignoring nature's call. Holding urine for extended periods may potentially lead to kidney damage through a process called hydronephrosis. When urine cannot drain from the kidney to the bladder, it may lead to increased pressure and swelling in the kidney. Over time, this may result in decreased kidney function and even permanent kidney damage. In the absence of treatment, severe hydronephrosis may result in kidney failure, necessitating treatments such as dialysis or a kidney transplant. A study involving more than 100 female nurses who often delay urination due to long working hours found that those who habitually avoided the bathroom actually enlarged their bladder capacity. However, over time, retaining a large amount of urine may weaken pelvic floor muscles, making it harder to control the urge to urinate. My patient Lisa, a nurse, often delayed bathroom breaks due to her busy schedule. After developing frequent urinary tract infections and kidney discomfort, she made a conscious effort to take regular breaks and stay hydrated. This change helped alleviate her symptoms and protect her kidney health. 9. Eating processed foods. When it comes to the management of kidney health, diet is an extremely important factor. Because of the high degree of dependence that people have on processed foods, you should be aware that a diet high in processed foods may cause leaky gut syndrome, which in turn raises the risk of kidney disease development. Processed foods cause dangerous chemical compounds known as advanced glycation end products, which are partially to blame for this. These products activate the body's danger signals, leading to an inflammatory response and chronic kidney disease. A study that included over 14,000 adults found that ultra-processed foods are associated with a higher risk of chronic kidney disease. The end result reported a 24% higher risk of kidney issues in people who consumed the most ultra-processed foods compared to those with the lowest consumption. Each additional serving of ultra-processed foods was associated with a 5% higher risk of the disease. For example, my patient Mark relied heavily on fast food and processed snacks due to his busy lifestyle. After being diagnosed with kidney disease, he started preparing more meals at home using fresh, whole ingredients. This change significantly improved his kidney function and overall health. 10. Insufficient sleep. The sleep-wake cycle controls kidney function by coordinating the kidney's daily workload. Insufficient sleep disturbs melatonin secretion, which regulates nocturnal functions and could affect kidney health. Sleep deprivation has been linked to health issues like hypertension, diabetes, and obesity, which contribute to a diminishing glomerular filtration rate, a key indicator of kidney health. Several studies have concluded that over 50% of end-stage renal disease patients have sleep apnea, a condition where breathing is interrupted during sleep. This is significantly higher than the general population. For instance, my patient Sam struggled with sleep apnea and often felt fatigued during the day. After being diagnosed with chronic kidney disease, he sought treatment for his sleep apnea and made efforts to improve his sleep hygiene. This included establishing a regular sleep schedule, creating a restful environment, and reducing screen time before bed. These changes helped improve his sleep quality and support his kidney health. 11. Lack of physical activity. Most of the time, we link physical activity with weight gain, but it also indirectly contributes to chronic kidney disease. Obesity may lead to conditions like fatty liver disease. Fat deposits in the liver and around other organs, including the kidneys, may cause inflammation and scarring, which impairs kidney function. In addition to that, inactivity may result in hyperlipidemia, a condition characterized by high levels of fats such as cholesterol and triglycerides in the blood. These fats may accumulate and cause damage to the kidneys, either directly or indirectly through associated cardiovascular diseases. A study involving 12 randomized controlled trials with chronic kidney disease patients found that regular aerobic exercise significantly improved key kidney health indicators. Particularly, aerobic sessions lasting over 30 minutes had a more profound impact on the filtration rate. Walking and running as forms of exercise were especially effective in improving serum creatinine levels. For example, my patient Karen was overweight and led a sedentary lifestyle. After being diagnosed with early-stage kidney disease, she started incorporating daily walks and light exercises into her routine. Over time, she lost weight, improved her cardiovascular health, and saw a positive impact on her kidney function. 12. Excessive meat consumption. Meats are rich in sulfur-containing amino acids, which are metabolized into sulfuric acid, increasing the acid load in the body. Chronic high acid loads may lead to metabolic acidosis, a condition that may cause kidney damage over time. A study involving around 4,900 participants examined the link between different protein sources and the risk of developing chronic kidney disease. Individuals who ate the most total red meat and processed meat had 73% and 99% higher odds of developing chronic kidney disease, respectively. Interestingly, replacing one serving of red or processed meat with low-fat dairy, nuts, whole grains, or legumes reduced the risk of chronic kidney disease. For instance, my patient Alex enjoyed red meat and processed meats regularly. After being diagnosed with kidney disease, he started replacing some of these meals with plant-based proteins and fish. This dietary shift helped reduce his acid load and improve his kidney health. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "Great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. Understanding which habits can harm your kidneys is crucial for maintaining their health. By avoiding or limiting these 12 detrimental habits: insufficient water intake, overuse of painkillers, high salt intake, excessive alcohol consumption, smoking, excessive caffeine consumption, high sugar diet, ignoring nature's call, eating processed foods, insufficient sleep, lack of physical activity, and excessive meat consumption, you can take significant steps toward protecting your kidneys. Remember, your kidneys work tirelessly for you, and they deserve all the support they can get. Make informed lifestyle choices and consult with healthcare professionals to tailor your habits to your needs.